Ohio State, including the evaluation process and follow-up care. It is also a chance for you to get to know a little bit more about the Ohio State University Wexner Medical Center and the care team at the Comprehensive Transplant Center. We want to first introduce you to two core groups of liver transplant doctors here at Ohio State's Wexner Medical Center. A transplant surgeon will evaluate you for surgery and perform the liver transplant. A transplant hepatologist will manage your care while you wait for your new organ and monitor your new liver once transplanted. Since the call to receive a new liver can occur anytime, day or night, all our doctors work seamlessly together to provide your care. The liver transplant process can seem very complicated. In order to make it easier to understand, we've broken the process down into 7 steps so you will have a better understanding of what to expect along your transplant journey. The first step is the referral phase. The fact that you are watching this video already means that your doctor has referred you for liver transplant consideration. Step 2, the education phase, is why you're here today, and it often occurs simultaneously with Step 3, testing, and Step 4, evaluation. Testing for liver transplant evaluation starts as soon as your medical insurance provides approval. You will be scheduled in the transplant clinic to meet with a transplant surgeon, transplant coordinator, transplant dietitian, transplant social worker, and transplant financial coordinator. Once the testing and evaluation are completed, your case will be discussed at Step 5, the Liver Transplant Selection Committee. That meets weekly. If recommended by this committee for transplantation, you will be placed on the liver transplant wait list, Step 6, until you get the call for transplant, Step 7, the last step along your journey before surgery. Some patients are very ill, and all of these steps may be completed while they are in the hospital. The liver is the largest internal organ located on the right side of the body. It typically weighs 3 to 4 pounds. In a healthy liver, blood flows through the liver tissue, which is processed for many uses. The liver is responsible for making bile, a yellow-green fluid needed for digestion, cleaning the blood by removing medicines and toxins like alcohol, and producing proteins that help with blood clotting, fighting infection, and hormone regulation. A healthy liver is the only organ in the body, besides the skin, that is able to regrow itself, also called regeneration. A diseased liver can't regrow properly, and instead of growing healthy cells, it regenerates scar tissue. Scar tissue does not allow good blood flow through the liver, causing permanent liver damage. Cirrhosis can occur when the liver develops too much scarring. No matter the cause of your liver disease, liver cirrhosis is what leads most patients to need a transplant. These are just a few of the most common causes of liver disease. However, there are several conditions that can lead to liver failure, and you being a candidate for liver transplant. Most patients with chronic liver failure have dealt with one or many of these complications during their illness. These occur when your liver is not working or functioning like a normal liver. These complications are managed by your hepatologist, and most can be treated with medications or procedures. If you have any questions or concerns about any of these complications, talk to your hepatologist about options for treatment. Liver transplant is the only treatment for end-stage liver disease. If you do not wish to pursue transplant at this time, please go back and see your hepatologist for management of your symptoms. Depending on your disease, if you choose not to have a liver transplant, you may pursue medical management of your symptoms, get a second opinion, or opt into receiving palliative care. Liver transplant is a life-saving procedure that allows you to have an improved quality of life and a decrease or end of your symptoms. There are risks with any surgery like a liver transplant. You may have difficulty with bleeding, infections, or biliary leaks after transplant. Your medical team will go over these risks and speak more about them with you when you meet with the liver transplant team during your surgical appointment. After transplant, you will have to take anti-rejection medicine, also known as immunosuppression medications, every day for the rest of your life. These medicines weaken your immune system to prevent it from attacking your new liver. Your body is still able to fight off infections like colds or flus, but you will be more likely to catch an infection while taking the immunosuppression medications. You will have frequent blood work to monitor the levels of medication in your blood to ensure the level is good enough to prevent your body from attacking your new liver, but not too high that you can't fight off infection. relation to your individual health problems. After transplant, when welcoming anyone to your home, all visitors should wash their hands. Frequent hand washing from you and those around you will significantly reduce your risk of infections. Everyone who is evaluated for liver transplant undergoes the same initial evaluation testing, which includes abdominal imaging, blood testing, cardiac testing, lung testing, and a chest x-ray. Additional testing may be needed for your case, depending on your particular medical conditions. Cancer screenings are very important for potential liver transplant candidates. Immunosuppression medications given to prevent organ rejection can lower your healing ability and turn on cancer cells, sometimes causing them to grow and multiply. For this reason, transplant candidates need to have a dental clearance within the last year to rule out oral cancer or signs of infection, and a colonoscopy if you are over the age of 50 or have other colon cancer risk factors. Females need to have a pap smear within the last year, plus a mammogram if you are over 40 years of age or have a family history significant for breast cancer. Males need to have a PSA screening if there is a high risk of developing prostate cancer. When you come in for your appointment to see the liver transplant surgeon, you will meet with several different providers the same day in the transplant clinic. You will meet with a transplant nurse coordinator who will review your health history, medications, and answer any other questions you may have about the process. This coordinator will also be your point of contact for transplant-related questions during your evaluation process. You must bring one support person with you to the clinic evaluation day when you meet with the transplant team members. Social work evaluation includes an in-depth discussion covering topics such as your background information, living situation, support system, income, work history, drug and alcohol history, and mental health history. The social worker will also meet with your support person to evaluate their ability to support you during the transplant process and after surgery. Your insurance status is crucial for being placed on the wait list and remaining active. The transplant financial coordinator will verify your insurance benefits for transplant evaluation and transplant surgery, as well as your pharmacy benefits for the medicines you will take for the rest of your life after transplantation. The financial coordinator will also work to obtain authorization from your insurance company, if needed, for your transplant evaluation and will discuss your specific financial situation and answer your insurance questions. Prior to your transplant evaluation, a transplant financial counselor will contact you to discuss your financial situation to assure that all of your financial needs can be met. The financial evaluation will take approximately 15 to 30 minutes and will cover information such as income, assets, resources, monthly expenses, and any financial concerns. Because your nutrition is an important factor to the success of your transplant, you will also meet with a transplant dietitian. This nutritionist will review the medicines you are taking, including vitamins and herbal supplements, go over your nutrition history such as diabetes diagnosis and management, discuss recent weight changes, both gains and losses, review your eating habits and any eating issues, check on your food allergies, discuss oral nutrition supplements like Ensure and Boost that you take or have previously taken, and will perform a nutrition-focused physical exam. Every patient is different, so based on your needs, the dietitian may point out opportunities for improving your overall nutritional health. During your physician appointment, it is a good time to ask questions and clarify information about the liver transplant with a liver transplant surgeon. This doctor will review your medical history and current health to decide if additional testing is needed to evaluate you for transplant. Liver Patient Selection Committee, also referred to as PSC, is a multidisciplinary group made up of transplant hepatologists, liver surgeons, cardiologists, psychologists, pharmacists, dietitians, social workers, transplant nurses, and financial coordinators. The Liver PSC discusses your case and decides the best treatment option for you, taking into consideration your medical history, ability to care for your future liver transplant, any potential surgical complications, your support system, potential completion of an alcohol and or drug treatment program if needed, and your engagement in the transplant process. The Liver PSC follows a set of guidelines to determine if a patient can be placed on the transplant wait list. These guidelines outline the criteria for transplant and have two categories: absolute contraindications and relative contraindications. These criteria standards were developed to improve the chance of long-term survival with transplanted liver. The first absolute contraindications lists a set of instances that will stop a patient from being listed for transplant at that time. This could lead to reevaluating at a later time based on the patient's need. Absolute contraindications include failure to meet chemical dependency requirements, active infection outside of the liver that can be dangerous once placed on medications that suppress the immune system after transplant, significant heart and/or lung disease that would prevent survival during or after transplant, and psychosocial issues, including uncontrolled psychiatric illness and lack of sufficient social support. The second guideline category, called relative contraindications, lists a set of instances that could potentially be unsafe for transplant surgery, but patients may still qualify for transplantation if the team feels the benefit of transplant outweighs the risks. Relative contraindications include active malignancy or cancer outside the liver due to immunosuppression medication required after transplant, hepatocellular carcinoma, cardiopulmonary disease, active hepatobiliary sepsis, uncontrolled diabetes mellitus, which can interfere with healing after transplant, noncompliance with the medical regimen, severe dysfunction of multiple organs, which may alter survival after transplant. Other contraindications not listed here could arise on a case-by-case basis. After liver patient selection committee reviews your case, there are 4 potential outcomes. You may be approved for listing, and you may also be approved for living liver donation. You could also be told that additional testing is needed to make a good decision about your case. Or, lastly, you may be told you are not a candidate at this time. If additional testing is required to complete your liver transplant evaluation, a member of the liver pre-transplant team will call and inform you of the decision and discuss additional required testing. If you are not a candidate for liver transplant at this time, please continue to follow up with your hepatologist. Your hepatologist will work with you to help correct the situation preventing waitlisting and can refer you for liver transplant evaluation in the future if the situation is resolved. If you are recommended for liver transplant by Ohio State's Patient Selection Committee, you will then need to be approved by the Ohio Solid Organ Transplant Consortium and receive final insurance approval before you can be officially placed on the liver transplant wait list. This process can take up to 2 weeks, depending on your insurance company. Once approved, your transplant nurse coordinator will call you to have labs drawn to place you on the wait list. There are 2 options for a patient on the transplant wait list at Ohio State: a transplant from a deceased donor from the wait list, or a transplant from a living donor. If you have a compatible living donor, surgery can be scheduled as soon as testing is completed to avoid a lengthy wait time. Your placement on the wait list is determined by your MELD sodium score. MELD stands for Modeled for End-Stage Liver Disease, and Na is the chemical symbol for sodium. Your MELD sodium score is determined by a blood test that assists with organ allocation in the United States and is calculated based on 4 values. INR, which is a measurement of how well the liver is producing blood clotting factors. Creatinine, which is a measurement of insult or abuse to kidneys. Liver damage causes insult to kidneys that can result in kidney failure. Total bilirubin, which is a measurement of the liver's ability to filter blood and excrete bile from the liver. And sodium, a measurement of fluid balance within your body. A normal MELD sodium score is 6 or less and means your liver is healthy. The higher your MELD sodium score, the sicker your liver is, and the more quickly you will receive organ offers. At a MELD sodium score of 15, studies have shown the benefits of transplant outweigh the risks. Most liver transplant patients at the Ohio State University Wexner Medical Center are transplanted with a MELD sodium score between 20 and 30. A MELD sodium score of 33 or higher allows us to pull organs from a larger radius, as this score recognizes patients with the greatest need who are very ill. This MELD sodium scoring system allows for the sickest patients to be first in line for a liver transplant. Other factors that determine if you are a match for a donated liver include your blood type and weight range. Your surgeon will determine a weight range that is appropriate for your donor. We encourage all patients undergoing evaluation for liver transplant to consider a liver from a living donor. The wait times for a liver from the deceased donor transplant list can be many months to years, depending on a patient's MELD sodium score. Receiving a transplant from a living donor allows for patients to be transplanted reduces the risk of becoming too ill to safely receive a transplant. Surgeries can also be scheduled for the best possible outcomes. Donors at Ohio State must have a matching blood type to the recipient and are generally between 21 to 55 years old. For more information about living liver donation, please speak with your transplant nurse coordinator. Every effort is made to ensure that infectious diseases or cancer are not transmitted to liver recipients. Although very rare, every donor has the ability to transmit infectious diseases and or cancer to the recipient, even when preventative testing is negative. There's no testing in the world that is 100% accurate. If a donor tests negative for an infectious disease but meets an increased risk category by the CDC, you will be notified prior to transplant. Examples of increased risk categories include a donor whose medical history is not available, recent jail time, history of IV drug use, and history of sexual promiscuity. This list is not all-inclusive. The risk of transmission if you choose to accept an increased risk organ is low. An increased risk organ is a donor who has tested negative for infectious disease but meets a CDC increased risk category. It is not held against you if you turn down an organ offer that is of increased risk. At this time, you will be given the option to receive organ offers from donors with active hepatitis C. Should you accept, your blood work will be monitored to determine when you might acquire hepatitis C, and in the event that you do, start you on a course of effective treatment. If you have more questions about an increased risk organ, you should talk with your hepatologist or surgeon. You may receive an organ offer from a DCD donor, which stands for Donation After Cardiac Death. This patient's heart stopped beating for approximately 5 minutes before an organ recovery begins, delaying the blood flow to the organs for several minutes before they are put into a cold preservation container. However, the majority of our organs transplanted are from a donor who has died from brain death, in which blood flows through the organ up until the time of recovery. You may also receive a partial liver transplant. This liver will grow to the size of a normal liver in about 3 months and is called a split liver transplant. This option allows for 2 people to benefit from one liver that is split into 2 halves, with the other portion often used in a child. A donation after cardiac death and a split liver carries a slightly higher risk for complications after liver transplant surgery. If you have further questions, feel free to discuss your concerns with your surgeon or hepatologist. Wait times for a deceased donor transplant vary greatly. Patients with lower MELD scores should expect to be listed for a longer time period prior to transplant. While you are on the liver transplant wait list, it is important for you to keep your contact information updated and notify us of any recent health status changes, including hospital stays, surgeries, infections, and dialysis. Also, maintain a healthy lifestyle, staying active, quit smoking, maintain a healthy weight, and continue to see your primary care physician and hepatologist. While you are on the liver transplant wait list, you will also need to have your MELD sodium labs drawn monthly unless your score is 25 or greater. If your MELD sodium score is 25 or greater, you will need to have your labs drawn every 7 days. If you don't live close to an Ohio State lab facility, we can fax lab orders to a lab that is close to your home. While on the wait list, it is required that you have your MELD sodium labs drawn before each deadline. If labs are not updated in time, you will be placed on hold and miss organ offers. It is important that while you are on the wait list, we are able to contact you at all times. Please keep your phone on and return phone calls as soon as possible. It is crucial to have your voicemail set up. If we cannot reach you, we will attempt to call the people listed on your contact list. If we cannot reach you within 1 hour, we will move on to the next person on the transplant list. We will make every effort to contact you by calling you multiple times and calling the names listed on your contact list. The transplant coordinator that calls you will ask you screening questions about your recent health and report back to the physician. You will also receive directions on where to go to check in for surgery. Please keep in mind that there is a chance the organ may not be usable once it arrives at the hospital, and you may be sent home. Ideally, surgery is performed as soon as the organ is available. However,